A very good morning. Dr. Aruna,
Okay,
Nadem.
one second. You need to give me the permission to record. Lakshmi.
One second. Okay, we are here. Okay. So, good morning, Nadem. Good morning, Aruna. So today, we see that we are seeing a lot of evolving trends where a lot of studies are showing, the statistical graph says it's going to end soon. And still some of the evidence says that it may continue for 6 more months. So whatever it is very important for us, because once this lockdown is over, we have to face the society, and we have to see the trend. So that it's very important for all of us to follow personal hygiene both at house and when we go outside. And when we come back, we should see that the same sort of hygiene what we are taking outside should be happening in the house. Otherwise we'll be bringing infection inside and we'll be infecting the our household people. So we need to understand the cycle of the disease, where majority of them, when the disease spreads, they are not symptomatic. So there may be a lot of asymptomatic people who may be actually spreading the disease. So irrespective of whichever level you are, it's very important to wear the mask and maintain hand hygiene, and see that even the slightest of symptoms, isolate yourself and see that you don't be the point of contact to others getting the infection. And we, being professionals, we will be facing the same trouble in more frequency when we are operating in a regular trend. So the same thing should be, everybody who are working in a normal life should think that they're also doctors in their life. And whatever we as doctors are taking precautions, every citizen should follow same methodology, that their houses are nothing but operation theaters. The people who are living there are people who should not be infected. So the same situation has to follow till this pandemic gets over. So now, as we go on, I think now we will go on to Aruna, who will give us some inputs about how, as a natural trend, we have been changing to our modern lives, and how our immunity has been coming down because of a change in diet habits, and how we were more better prepared than what we are prepared now because of our dietary modifications we have made, either knowingly or unknowingly. So now back to Aruna. I think you can go on.
Okay, so I would like to point out that viruses traditionally have been there for since mankind, okay? But why is it now that for the past 25, 30 years, we are listening to so many kinds of viruses coming up, and it is affecting all the human beings across all continents and countries. So 100% this is linked to one's personal immunity, okay? So whenever the immunity level goes down, you are surrounded by bacteria and microorganisms and viruses. So when does it actually enter your system? It enters your system 100% if your immunity is very, very less. So why as a population we have become, as a population we have lost our immunity? So the main thing is wellness and proper lifestyle changes are not being followed. Number one is, for the past 30, 40 years, if you observe, we have increased our consumption of sugar. So sugar, even 10 grams of sugar in your diet has known to increase your insulin response. At the same time, play havoc with your insulin response, and also at the same time has seen that it lowers your immune response also. So if you keep taking more than 10 grams, imagine what can happen. Only if 10 grams can do so much damage to your diet, imagine how much, like if a pastry or a sweet can actually do to your system. So consumption of sugar is the topmost reason of lack of immunity today. And various studies have also showed that this reduction in immunity has led to the increase in cancer, infections like these viruses, and so many other reasons. So number one changes in the last 40 years or 50 years is increase in the consumption of sugar. The second thing is increase in the amount of meat that has been consumed also. So much meat was never traditionally consumed anywhere in the world. So meat was there are more availability of meat and increase in the amount of meat also has led to, reduction in the immunity. Has led to the reduction in the immunity. Third reason is overcooking of, everything we need, like, fast food and ready to eat food and stuff like that. And that is also led to a reduction in your immunity. See, fast food is generally prepared with processed food and it is not prepared with whole grains. So obviously they have been refined more and more and then cooked more and more for a long time also. And absolutely they are stripped of all nutrients. So at the end of the day, when it's on your table, what you're eating is nothing but junk. So as the name rightly says, it's junk food. So that also has led to the decrease in immunity. Tell me how many of us actually eat some amount of raw foods or raw vegetables in our diet? Actually nobody, except fruits. And those fruits also are organic, not organic, and we are scared to eat them. So these lifestyle changes have actually led to the decrease in immunity as a population, as a race, or whatever. And that's why you see the spread of the infections all over the world. So if we are not going to increase this immunity level, definitely every 5 years we'll be having a pandemic or whatever. I can't predict such things, but definitely we are going to have repeated infections and there are going to be a lot of cross infections. So what do we do now? Whatever you wash, you sterilize, you wash your hands, it's all external. So let's do something internal also, so that if the virus is there also, it doesn't enter into your body. So how do you actually ensure that? By following a very, very nature-friendly diet, a very, very immunity-enhancing diet. And these are all very simple things. We've been discussing this for the past week, and I've showed you so many miraculous things in the kitchen, which actually increase your immunity at very low cost, and you need not go in search of these things also. So primarily, start incorporating all this as a lifestyle change and reduce the sugar and processed food. And I'm not saying stop eating meat, but reduce the consumption of meat and stop overcooking the food and start eating it in a very, very natural way and close to nature, so that your immunity levels go up. Your system can, actually understand that. You just test for a week. Take lemon water or ginger water or pepper water or turmeric water for a week and see how your system responds. So this virus can stay away only when you change your internal habit and alter your lifestyle and make it a part and parcel of your everyday life. So external things should be done. There is no doubt about that. You have to wash your hands and all that. We know already, we've been listening to it a lot, but start working on the inside of your system also, so that some amount of immunity is increased. And naturally immunity is your first response. If you don't have that, we would have been bedridden and disease ridden by now. So just start increasing or working on increasing your immunity levels.
So before we go to Nadem, so as a doctor, I want to give few guidelines. So everybody what supplements we need to take. What are the supplements will really help us in increasing immunity? Whatever I am saying is evidence-based. See, most important is zinc. Zinc plays a very important role in improving our immunity, and majority of the diet, whatever we're taking, sometimes we may not be having zinc. So we may request zinc supplements. Number 2 is vitamin C. Vitamin C also plays a very important role like antioxidant and immunobooster. So we have to take, whenever such episodes are occurring, vitamin C is again a very important vitamin we need to take. Number 3 is omega fatty acids. So to withstand all the stress-induced viral infections, omega fatty acids also play important role in increase our immunity. And the 4th one is our gut immunity. See, whatever is happening, whatever happens is to the oral cavity, our gut plays a very important role in giving some sort of immunity to us. So whenever we have a small issue with the GI system, taking probiotics. So probiotics also play a very important role in improving our immunity, and by not allowing unnecessary organisms to stay in our body, enter into our body. So if our body is filled with lot of good organisms, then a pathological organisms may not be able to come in. So like as a doctor, so if to my patients I advise is Definitely zinc you need to take 100%, and vitamin C as supplements, omega fatty acids, especially for old people. It works very well for heart also. And of course, probiotics in requirement. Yes, yes, Aruna.
Omega-3 fatty acids, the best source of omega-3 fatty acids right now, apart from the supplements which you are actually advising, which is a very good thing, would be flaxseed. You can take flaxseed every day, powder it, and just add it to your curries. So you won't even know it's there and you'll be consuming it. And it is proven that one more thing I would like to add is, see, it's very, very essential that you take supplements, but at the same time, whatever is there in the diet gets absorbed better. So start incorporating these things into your diet also, because our DNA or our body is more used to these kind of things, and it better absorption rate is there.
Natural,
So
natural ones.
natural modes. So take the supplement and ensure that these things are there, and also ensure that the reduction in whatever I told you, the unwanted, unnecessary things like sugar is not there in your diet.
Over to Nadeem. Nadeem, we are with you.
Yes. Okay. Yeah. So now, as the discussion I was observing, there's so many conflicts of the people have. Like as Aruna said, the change happened of the lifestyle from past 20, 30 years. So we used to go and play in the rain. We used to go and play in the mud. So we used to have that immunity to fight with whatever this thing comes. So slowly what we have done to our kids is to avoid them to go into the rain, avoid them go into the mud, because we have polluted the most of the things. Like maybe a few years back, people used to drink the water directly from tank bund.
Yes.
Now we cannot even touch the water. So that's how we have polluted. So there we have to be away from the certain things. We used to drink directly from the tap water. Today people are without distillery water we are not able to survive. So as a human beings we have destroyed our nature, and
Yes.
we try to come away from the nature. So this is a time to protect our nature and go back into the nature. That's what we have to do. So today I wanted to show a little bit of exercises. You don't need a gym, you don't need anything. If you have a terrace anywhere, you can go and do something in the nature. So I just wanted to share these videos with you.
We are ready for you,
Yeah,
Nadeem.
yeah. So friends, you can actually start participating these exercises.
Nadeem, don't keep the music because sometimes copyrights the music they're not encouraging.
Yeah,
So
yeah,
we
sure.
like only your exercises and you can talk.
Yeah, yeah, sure, I'll do that. One
This is
second.
Harita, no?
Yeah, Harita, yeah. Sorry. uh, Ready? I'm just
Yes, yes, we are ready,
playing
Nadeem.
this. Yeah. This is actually, you can do these kind of exercises anywhere. So just do a spot jog for some time. So if you do this kind of jogging, you'll develop a warm up your body. So you can do it at your terrace, you can do it at your home also. If you have a small hall where you can do these exercises, there's a spot squats where you can actually working out for the major muscle group of your body. So thigh muscles is the major muscles in the body. So we are working out for the thigh muscles. So every exercise you have to do 10 times. These are pectorals or chest muscles, simple push-ups. Anybody can do it. If ladies, you don't have strength, you can do modified push-ups. These are just modification of the lower body. So it will take only 5 to 10 minutes. Uh, this is the ab exercises. So when you do this kind of ab exercise, your core will be strong. So when the core is strong, you avoid a lot of back pain, and you will be fit to do anything in life. So there are different muscles in the core, which I'm trying to strengthen out. Sides. So it doesn't take much time. If you combine all the exercises, it's called circuit training. Basically, stay at home and you can do this. And as yesterday I told you, you can use the water bottles to strengthen your biceps, your shoulders, your lats. All these exercises can be incorporated. So I'm doing the whole body exercises, just 10 minutes. I mean 10 repetitions each exercise. You can do it 2 sets, 3 sets, depending on your capacity. If somebody wants to have more weights, then you can use the dumbbells or you can use the other things at home. Yeah, this is the
Okay.
some of the exercises. Okay.
So, like if we see, we have become more and more sedentary, and we are taking lot of sugars, like Aruna has said. So, I think a majority of the things, what happens is we have to live as close to nature as possible.
Possible.
As close to. So when you're taking diets, the diet should be more and more unprocessed. And we're doing activities, we are trying to become more and more civilized in a way, civilized to keep ourselves healthy. That means civilized means we need to do some sort of activity, because we are becoming, when we're becoming more civilized, we are becoming indirectly more uncivilized, because we are not doing any activity. We are sitting and we are trying to relaxing our mind, but we are not giving any work to our body. So as we know, mind, body and soul, everything should be working in coordination to live happily and healthily, because whenever our immunity has to go down, everything has to go on very well. Even if one part is not working, our thought process not working, we are always scared of the disease, then our immunity is going to go down automatically. If you're not taking proper diet and we are not encouraging our immune system adequately by giving adequate supplements, we are going to become very weak. There is no activity. If in fact, if you see all sports persons and people are very active, they have a less tendency of getting all these cough and cold. Even if it comes, it's so asymptomatic, it just comes and goes. In fact, you see a lot of sports persons, they are playing even when they are having cold, playing even when they are having a lot of body pains, because all this becomes very insignificant. So all this is because of their natural immunity. Nadem, you want to say something?
Yeah. So here in Gandhi Hospital, they observed that a lot of patients who is recovering fast is the people who is mentally fit,
Yes.
who have the desire to survive.
Yes.
So mental fitness is so very, very important here. I request Lakshmi Garu to invite somebody who has survived, maybe tomorrow program.
Yes.
Because mental fitness is very important, either to fight disease, to survive. The survival instincts of the human being will allow us to fight any disease.
So tomorrow I'll encourage lot of people who have survived, who are survivors. Survivors means who have gone very close to ending their life and they came back with fighting spirit. So there are a lot of people in my lifetime of being a doctor and a surgeon. So tomorrow I'll invite whoever available to come and talk with us to encourage our community to that the fight to the zeal to survive, the fight to survive at any cost, whatever it may be, and fighting till the end of our breath. That should be our motto, and we have to keep fighting. And yes, Nadem.
One more thing, who are watching this program, I request them to send us some questions so that we can answer them. Otherwise, it's looking like one side. We wanted to have, why we are here is to help our patients. We are here to help our friends. So please ask us questions so that we'll come up with the answers.
Sure, Nadem. And thank you, Nadem. Thank you, Aruna. And viewers, I want you to enjoy this program and implement whatever we have said. And whatever we said is evidence-based and very practical. And I want all of you to follow and make your life healthy and happy. Thank you.
Thank you.